Good day, and thank you for this opportunity to give a brief overview on some of the new developments within the Communities Against Rabies initiative that's spearheaded by GARC. As many of you do know, rabies still affects up to 150 countries around the world, and to this day the burden remains highest in rural communities that are often resource limited. And there are efforts at a global level to eliminate rabies, and the most important of this is the Global Strategic Plan that relies on governments to lead their own rabies elimination efforts. But as we see with any programmatic activities, governments also face certain limitations and challenges that simply prevent them from reaching all of the at-risk communities that they need to serve. But all hope is not lost, as those gaps that are left by the governmental limitations are often covered by non-governmental stakeholders who serve communities while also being willing and interested in collaboration and improved capacity. And by partnering with these community-level organizations, GARC ensures that the national strategies can translate into long-term sustainable impact, but where communities need it the most. Broadly, this is done in three different ways. Firstly, by expanding the knowledge and skills of both individuals and organizations alike, by providing expert guidance, tools and resources, and coupling that with continuous support from our organization, and also raising the stakeholders' profile by highlighting their rabies elimination efforts internationally through various social media platforms. But this support is not haphazard in any way, and we rely on an established, structured program that has proven effective in several countries. More specifically, the successful implementation of this program relies on a phased approach and uses tools that have already been developed and made available. And typically, this initiative or program is rolled out in different phases from the individual level up to ongoing support for the organization. And we'll talk about them in detail, but we have to start with the capacity building at the individual level. The problem we encounter most often at the individual level is a lack of knowledge and training. Whether we are referring to an animal health professional who receives multiple years of training, there's still no dedicated focus on rabies and communicating that knowledge. And similarly, at an organizational level, they quite often rely on well-meaning volunteers that, although they are kind-hearted, they don't necessarily have the knowledge and skills that they need to effectively engage with their community members. And it's because the knowledge that's needed is more than just what is rabies or how to prevent it. People who engage with community members need to have an extensive knowledge base to which they can refer to when they engage with their community members. And the solution that we have for this problem comes in the form of the GARC education platform and its series of online courses that can be used to address these critical gaps amongst any stakeholder. This online platform provides access to a series of certificate courses that are offered at no cost to the end user. And by providing our animal health professionals and volunteers and any other interested stakeholders with standardized knowledge and training that's up to date and relevant, we aim to empower graduates to become rabies advocates, community coordinators, and animal welfare ambassadors in general. For today, I just want to give a very brief overview of the different courses that are available on the GARC education platform, starting with the Rabies Educator Certificate, the foundational course, and following that up with the Community Coordinator for Rabies Certificate. And while both of these courses give graduates a certificate of completion, they also receive recognition for completing these courses by becoming recognized as a bronze level dog health champion. If they continue their educational journey on the education platform by completing the dog welfare certificate and the animal handling and vaccination certificate, they then also become recognized as a silver level dog health champion within their communities. But to us, these are more than just individuals receiving an extra level of recognition, as we believe there's real value in these educational courses. And as such, the dog health champions are considered to be a dog health focused workforce that drives rabies elimination at the community level. To date, we've seen an ever-growing increase in the number of graduates from these educational courses, but also in an increase in the number of these certified or recognized dog health champions, with almost 1,200 of these individuals working within the communities that they serve. However, the reach and impact of these courses go beyond just number of graduates or number of recognized individuals, because there is real benefit to the individuals that have done these courses as well. And although this is just a preview of some of the things that these graduates have said, we see a recurring theme among these individuals. And we see things like people feel surer of themselves and they feel more confident to engage their communities because of the information that they've learned. And then we also see a level of people saying that these courses have actually benefited them professionally. But in addition to building the capacity at the individual level, we also acknowledge that they quite often work for different organizations, and that these organizations would also benefit from capacity building that is aimed specifically at them. And it definitely is important to build the capacity at these organizational levels. As I've mentioned previously, these organizations supplement the national governmental efforts, which means they play a vital role not only in rabies elimination, but also at improving animal welfare, typically in communities that would not have benefited from those if it wasn't for the presence of those organizations. That being said, despite the important work that they do, we have to acknowledge that these local level organizations typically get limited to no support from their national governments, and as a result thereof, they quite often face several critical challenges themselves. To help them overcome these challenges, our efforts focus on 4 different levels. Firstly, on the personnel of these organizations. And it's at this level where we help to expand the staff knowledge using the GARC education platform as explained previously. But we also support the organizations by helping them to collect their data from their communities in a more meaningful and impactful way using the GARC data platform. This tool allows these groups to collect, analyze and visualize their data in a more meaningful way, which not only allows them to make data-driven decisions, but to also engage with donors more effectively. At the 3rd level is our support towards educational outreaches. This is something that organizations typically do with resources that's donated to them, and these resources are quite often not actually fit for purpose because they're not localized or they're not in the right languages for use. And to support this, GARC provides organizations access to our extensive educational resource bank, and we can also help these organizations to craft and develop new educational materials that ensures that they have meaningful outreaches and education campaigns. And lastly, we assist these organizations by helping them to engage their donors and raise funds in a more meaningful way. And this is done by providing them access to a more streamlined approach to data capturing and analysis, allowing them to engage donors with visual representation that shows exactly where they work and the impact of the work that they undertake. And by making use of all of these tools and resources and by partnering with GARC, these organizations become recognized as rabies centers of excellence, a recognition that's given to them to highlight the fact that they are a valuable contributor to rabies elimination and improved animal welfare at the community level. And this program that only started very late in 2023 and initially focused on 4 countries very quickly expanded to other countries as more organizations started engaging with GARC as they wanted to become recognized rabies centers of excellence. And since launching the program in 2023, we currently have 22 rabies centers of excellence globally. But this is an ever-expanding network of organizations with many groups from around the world interested in also becoming recognized. But we don't just want to talk about metrics once again, because there's also a perceived benefit to these groups. And these are also important to highlight, with these centers of excellence reporting that they have benefited from the credibility and that they've have found benefit in forming part of this network of like-minded individuals, and that they have benefited directly from these tools and resources that they have now been able to access. But the support provided to these organizations doesn't stop at just the recognition element. And in fact, we aim to provide ongoing support to these organizations. More specifically, these organizations benefit not only from the expert guidance from GARC's global team or from international promotion of their work, but also of a third element, and that is the opportunity to access additional funding for collaborative outreach. And this is really important because these rabies centers of excellence still tend to work with limited resources. But with various rabies centers of excellence working in close proximity to each other, there's an opportunity for these groups to implement collaborative rabies vaccination campaigns that allows 2 or 3 or more centers of excellence to work together to reach new communities that would typically not benefit from these types of interventions. And to facilitate these types of collaborative outreaches, GARC started the Stronger Together grant. And this is a grant program that's made available to 2 or more rabies centers of excellence that want to undertake a collaborative outreach. And essentially, this grant benefits the awardees by funding the purchase of vaccine, supporting the implementation cost, but also helping them print and distribute educational resources and sensitization materials. And although this is a very new initiative that was only started late in 2024, 2 rabies centers of excellence in South Africa applied and successfully received this grant and were able to vaccinate an additional 2,000 dogs. And while this might not sound significant, without this grant, many dogs would not have benefited from any primary animal health care or vaccinations, which means it made a difference to the community and that community's dogs specifically. But this is just the start of the Communities Against Rabies initiative. It really is a growing network that is ever expanding, and I really look forward to being able to provide more of these success stories and impact at the individual and organizational level in the future. But thank you so much for this opportunity. And I really hope that we'll be able to stay in contact if there's any information about this initiative and the success stories or potential areas for collaboration with these groups that are working around the world. We look forward to hearing from you. But thank you for this opportunity. And if there's any questions, we'd be happy to answer them today.